KCTV5 is your school authority, and many of the big districts are now holding in-person or hybrid classes. One viewer asked this good question: do we know anything new about kids catching COVID? Our Joe Chiodo has new information from the CDC.
We've told you about the overwhelming evidence showing kids are much less likely to get sick from COVID-19 than adults. But a new report just released a week ago from the CDC shows they can still be carriers and transmit the disease in a big way. Listen to this. The CDC now saying there is an increasing evidence that children and adolescents can efficiently transmit COVID-19. During July to August 2020, the CDC investigated a COVID-19 outbreak that occurred during a 3-week family gathering of 5 households in which a 13-year-old was the suspected primary patient, and 11 subsequent cases then occurred after. So what does this mean? The CDC is warning families that despite the return to the classroom, you need to remain vigilant. Remind your child to social distance, wear masks, and wash their hands as frequently as possible. This new evidence proves young kids can transmit to anyone. Keep this in mind, especially if you're in a home with a vulnerable family member. Now for some better news. At the same time, this new report explains if a young child does get the virus, cases are still relatively mild.
That was one of the really interesting things about the report, is that the younger children less than 10 actually fared very, very well. And only about 30% of the total number of deaths that we saw in the children were in children less than 10.
Many of the children who died from COVID-19 had at least one underlying medical condition. We're seeing a lot of asthma or obesity as factors. Doctors are still trying to understand why kids in general don't get as sick. Some doctors now suggesting it's because their immune systems are on constant overdrive as they build up immunity to a variety of illnesses. That could offer more protection than some adults. There is a new worry, though, because of masks. As kids wear them, their immune systems aren't getting exposed to important illnesses as frequently as they're used to. That could lead to kids getting more sick down the road when we are finally living without masks. If you have a good question, email me at goodquestion@kctv5.com. Joe Chiodo, KCTV5 News.